And now I'm really delighted to introduce to you Dr. Monique Shaw, who is the program officer at the Robert Wood Johnson Foundation, which many of you know has really been at the forefront of looking at issues of structural racism and the culture of health. Monique?
Thank you so much, and thank you for having me today. I don't have any beautiful slides, but I hope that I can I was encouraged to spend some time speaking about the type of work we're funding at the foundation and other related opportunities. So I hope that I can provide that information to you in a way that is concise and clear without using slides, but happy to take any questions afterwards. So I'm really delighted to be here in this space with all of you today. There are several opportunities for the foundation to engage and address issues stemming from the glaring disparate outcomes in maternal health that we know are rooted in systemic and structural racism that perpetuates conditions where birthing people, particularly birthing people of color, lack access to quality, affordable, culturally appropriate, respectful, and relevant care. It's important for me to note that while we do not have a specific strategy at the foundation that focuses on maternal health, over recent years, the foundation has initiated discussions with grantees, field experts, and other funders to really begin to gain strategic insights and perspectives about the role of maternal health and well-being in achieving a culture of health, which is the vision for our organization. And specifically, as it relates to our healthcare system's strategy, prioritized a focus on maternal health. A couple of reasons that we first, we really felt a sense of urgency to respond to the maternal health crisis. But I think more importantly and more significantly, what happened is that we began to see our current grantees shifting their priorities to focus on addressing these inequities, which helped to illuminate for us the direct linkages and natural alignment of the work of our grantees and partners to our existing priorities and strategies that focus on healthcare systems transformation. And so that's exciting for us. Grantees and partners through the elevate for us not only the importance of focusing on issues related to maternal health, but also the impact of structural racism in the healthcare system on the disparate maternal and infant health outcomes. And also they were able to very clearly demonstrate for us how the current crisis is emblematic of systems failures and the need for us to center the voices of those who are most impacted. And so we began to see how our strategy to enhance the capacity and incentives for the healthcare system to meet people's goals and needs, and our increased focus on consumer voice and priorities as a guiding principle in our work, and then also our greater focus on dismantling structural racism in the healthcare system, that all of those things could really and firmly on maternal health. And so it became clear to us that not only are the drivers of the maternal mortality crisis multifaceted, were lifted up, reflected many of the changes that we've been looking to see in our work overall. And that's care that meets people's goals and interrelated needs, respectful care, culturally appropriate care, and free care. So this, our maternal health provided a clear case for the changes that we want to see in healthcare overall. In terms of funding opportunities, and I love to provide a few examples, we began focusing on enhancing the capacity and incentives for the health system, as a part of our strategy to meet people's goals and needs. And as an example of this, we're currently funding an effort led by the National Alliance to impact the social determinants of health, and also the National Partnership for Women and Families, and alongside their maternal health expert advisory group called Raising the Bar. And Raising the Bar makes an urgent call to healthcare, which we define broadly, to embrace and accelerate the transformation needed to achieve equity and excellence. And through this project, there are 5 imperatives or drivers that have been identified, which articulate what it means for healthcare to raise the bar and ensure that individuals, families, and their communities and their priorities are at the center. And also through this work, there will be a development, a set of 15 overarching principles that are being developed to describe healthcare's role and how it can advance health equity and achieve optimal well-being. And the principles as defined are also being applied in the context of maternal health, with a focus on reducing racial disparities in maternal morbidity and mortality, in order to create guidance for systems change, but also to really help bring the principles to life by defining conditions for optimal maternal health. And so we are really grateful to be working with NASO, who's leading the principles, and again, the National Partnership for Women and Families, along with their expert maternal health advisory panel, who's leading on the application of the principles to maternal health. So this is really great and important work that we're supporting that, again, makes a clear case for the importance of elevating solutions to the maternal health crisis as a mechanism and clear case for demonstrating the changes that we want to see in healthcare overall. We also have work in the space of measurement, and measurement is extremely important and not something that's often considered, and where there is additional, additional funding needs. And we're funding work that's been led by the National Birth Equity Collaborative to support the co-creation of a validated patient-reported experience measure, and to integrate patients' voice, community advocacy, and provider training into the development of respectful maternity care practices. MBEC is developing a respectful care framework training that has been formed and shaped by mothers' voices and their description of their experiences of mistreatment in healthcare settings. They're working closely with Johns Hopkins to validate a survey measurement for respectful care that will be included as part of patients' discharge survey at 4 pilot hospitals across the US. In terms of research, the identification of the appropriate healthcare research and policy questions that are important to Black, Indigenous, and other birthing people of color is essential to help build the evidence. And so in terms of our investments and support for researchers, it includes our support of researchers led by our Policy and Systems for Action grantees and portfolio that are looking at, for example, structural factors that adversely affect reproductive health outcomes and state policy levers and solutions to advance women's health equity. Also, the implications of state-level contraceptive policies for preventive health utilization, and also the examination of the differences in local laws and regulations to help really and better understand the impact of investing in infrastructure and a health in all policies approach to improving outcomes. We've also been really fortunate to support, alongside many other funders, the priority work, which is a nationwide study of the impact of COVID-19 during and after pregnancy of a racially and ethnically diverse group of women and their babies across practice settings in the United States. And we've been able to support investigators to ensure that authentic community engagement across all study activities is present, including in the recruitment process, choosing study questions and goals, and also in the dissemination of the results. More recently, the foundation is investing in community power building as fundamental for advancing health and racial equity. We are exploring more outside-in approaches to systems transformation and the importance of building community power. We're deeply in a learning phase about how community power plays a role in advancing our strategies to improve health and well-being in all of America. And as we're, exploring community power, which we as the ability of people most impacted by inequity to create change through their agenda around achieving a larger vision. We are exploring ways in which we can help build and increase community power by supporting the development, growth, and sustainability of organized groups of people with diverse perspectives and lived experiences who act together through democratic structures to set agendas, to shift public discourse, and to influence who makes decisions, and also cultivate ongoing relationships of mutual accountability that help, again, to transform systems and advance racial and health equity from the outside in. We have a recent investment to increase community power to advance birth justice that intentionally and strategically supports historically underfunded birth justice organizations that are championing Black, Indigenous, and other birthing people of color. And the aims of this work are to support community power building tactics and strategies to advance network and coalition building among these organizations, to shift narratives and to amplify and spread solutions by amplifying the voices of leaders in the field and the leaders of this work, to help promote policies and practices that address implicit bias and structural racism that impact maternal and infant health outcomes. And so we're currently working with 3 wonderful organizations for this work, Sister Song, Groundswell Fund, and the Ms. Foundation for Women. And they're working to re-grant funds to on-the-ground grassroots organizations that are working to advance birth justice. Each of these organizations are also deeply committed to providing the technical assistance to help build the capacity of these organizations, to help increase their base and deepen their networks, and also collectively advance their mission across intersectional issues. And so we're still very much so on a journey. There's lots of other work I could probably also mention that would be relevant here. But what's important is that, the more that we can begin to tell a cohesive story on issues related to maternal health, the greater it enables us to think about the work of transforming systems with a stronger narrative that centers racial equity and the voices of those most impacted, including birthing people and birthing people of color who, have been greatly impacted, by or through these disparities. And we also understand that birth equity can't be achieved with healthcare systems transformation alone. So we're working to identify the multiple strategies and approaches and the multiple levels that should be and need to be employed and that we can support through our funding, including building the evidence, the narrative change work that's necessary, the community power work, and work to support and amplify the voices of leaders to realize the changes that we want to see, where birthing people, their children, their families, and communities are thriving. And so our investments are aimed at advancing birth equity, have helped to really strengthen our work across all of our strategies to make them mutually reinforcing to advance our overall vision of a culture of health. And we're humbly excited to engage and support the work in this space, knowing that we are very new to this space, and we greatly appreciate the opportunity to share some information about our current investments with you today. And the last thing I'll mention is, that when we think about what success looks like, the maternal health field, particularly women of color-led organizations, have been leaders for an extremely long time in this space, generating and lifting up solutions that are spearheaded by the communities that are most affected by inequities. And despite the successes, the field and these same organizations and leaders are grossly underfunded and under-resourced. And so we are looking introspectively as well and working across the table with other funders to really look at our funding practices and interrogate our funding practices to really make sure that we're helping to be a part of the solution and not part of the problem, to make sure that we're helping to build the capacity of these organizations and helping to grow their power and their influence, which means sometimes funding differently, in lieu of our traditional funding that's linked directly to programmatic objectives, but really providing the flexibility and space that organizations need to nurture and that we need to fund in a way that nurtures authentic and meaningful partnerships that will pave the way for increased interaction and awareness about the issues that are most important, and that will allow organizations to work collectively across the intersectionality of these issues, and not fund prohibit that collective work. So again, this is quite the journey for us. We are so enthusiastic about the opportunity to continue navigating this space, making more meaningful and authentic connections, and engaging with you all on this very important work today.